Hello, good afternoon, everybody. Today is the last day of the Health 25 conference in Las Vegas. My name is Dr. Gaurav Mishra, and this is the 10th episode of the Health System Fix podcast. My guest today is Dr. Nisha Mehta. She's a radiologist who's subspecialized in musculoskeletal and breast imaging. She's the founder of the Physician Side Gigs and Physician Community forums where more than 200,000 physicians are members. She oversees several online communities which empower physicians with tools they didn't get during medical school. She's a writer, keynote speaker, and a physician advocate. She's a top LinkedIn health voice and has been published in Forbes, CNN, Washington Post, among others. This recording is slightly clunky just because we were in a loud convention center and part of the intro was recorded separately. So I hope you'll bear with me through any of the audio issues. Thanks for joining us.
Hi, good morning, everybody. I'm lucky to be here with Dr. Nisha Mehta. She's a physician and radiologist and founder of Physician Side Gigs. I'm a new member, but it's been amazing to be on this platform already so far. And we're at the health conference in Las Vegas. So thank you for joining me today.
Thanks for having me.
I'm really excited to talk to you about. I'm in a particular career transition right now, which Physician Side Gigs has been hugely informative. I would like to start with, first early part of your life and decision to go into medicine. What was that period like for you?
Yeah, right. Like I think we all have this origin story for what drove us to go into the space. I mean, for me, it was pretty basic. Like I grew up in Pittsburgh. My dad was a cardiologist. Practiced in a smaller suburb of Pittsburgh. And I grew up watching amazing relationships that he had with his patients, particularly practicing in a smaller area. So my friends had this game in high school where they would literally take bets on how long it would be when we walked into the mall before one of my dad's patients came up to me and was like, "Oh, you're Dr. Mehta's daughter. He saved my life. He saved my so-and-so's life, whatever." And I grew up seeing that. I dabbled in a lot of other things. I had always had an interest in policy and law, but I just kept coming back to just being a physician and having I think there are very few specialties that allow you to tie academic interest with personal passion and still make a decent living and do all those things together. And it just always felt like the right thing. Yeah.
And, I relate to that. I worked in Imperial County, which is a rural county in California, a couple hours east of San Diego. I worked there for about 4.5 years. And I remember walking through Costco and seeing my patients. I'm a child psychiatrist. So I saw one of my patients mid-bunch to his sister. And he saw me, he said, "This guy looks familiar, but he's in shorts and his beard grown. Not in a tie." So, I definitely relate. I think it's a special to work in a community that people recognize you.
Yeah.
And you're a radiologist by specialty. What inspired you to pursue that?
Yeah. So, I mean, I say this not at all in a disempowering way because those that know me know that I'm a big proponent of women in medicine.
Right.
But honestly, the decision to go into radiology was a somewhat practical one. I met my husband in college. Both of us were part of a medical program. He had sort of had his heart set on surgery from the minute I met him. And I'd grown up around medicine. I knew, if I was going to marry him, just managing that dual doctor lifestyle for me in my head automatically cut out certain specialties. And so, and again, this is not because I think the woman's career should take a back seat, but I was one of those people that went through med school and I liked everything. Maybe 2 or 3 rotations where I was like, oh, I definitely wouldn't want to do that. I knew I didn't want to be a dermatologist. There were certain things I didn't want to do them. But then everything else, I was like, I love all of this. I loved the academic material and I found it so interesting. So I was like, I could see myself doing any of these things. So now I'm thinking a little bit more about flexibility and lifestyle. And at the time when I was in med school, everybody thought that on the ground radiologists were just not going to be a thing. It's going to be teleradiology for everyone. And I was like, well, then I can if my husband is working 18 hours a day, I have a little bit of flexibility. And so the decision to go into radiology was I liked the content. I liked that I got to learn every specialty. But, as a med student, as a radiologist, it's not that exciting. You literally sit behind the person who's actually reading and watch them. And so once I joined residencies, I was so pleasantly surprised by how much I love it. And I'm that person who scrolls through the MRI and I'm like, God, that anatomy is just so gorgeous. So I do think I landed in the right place. It all worked out.
I mean, I relate because my dream from when I was 5 was to be a physician.
Yeah.
So when I got into med school, in my head, I had already made it. So the specialty was a secondary thought for me. And yeah, I went through, I want to do OB, I want to do ortho, I want to be surgery, like all of these different specialties, cardiology.
Yeah.
And eventually I realized, the patient interaction is what I enjoyed most. So I was thinking family medicine or maybe psychiatry. And I think I landed the right way. And
I considered psychiatry, and
Right.
literally was like, my husband was literally like, I do not think it would be right for you. He's like, you just will not be able to detach. And he was like, you will take it home with you every night. And it's true. On my psychiatry rotation, I came home at like 10 o'clock every night because I just never extracted very well. And I think after seeing me go through that, he was just like, that's probably not the specialty for you. But I loved it. Like, I genuinely, it's such a great way to just connect with somebody one-on-one, which I love. So
I'll disagree a little bit with your husband assessment, because I think the way, at least the physician sidekick community, you've grown that. I think you're able to, you've really brought it many different points of view, which is what patients in psychiatry need.
yeah.
So maybe in another life you would have been great. But
yeah.
one of the things I also hear that you were already thinking about designing a life for yourself early on, right?
Yeah.
Even before you went into residency, which is unfortunately, I think most physicians, even going into training, designing a financial life and designing a life you want to lead, they're not doing that.
Right.
Along with the work burden that we have, I think that's also partly responsible for why we end up in places that we don't want to be in.
Yes. I think that is I don't know, 10,000% true, right? Like, and the issue is the way that the system is set up, right? Like, basically when you're 17 years old, you check off some box that says, I want to be a pre-med. The next 15 to 20 years of your life have already been determined for you, right? And you really, along the way, somebody tells you what tests you're going to take, what classes you're going to take, what applications you're going to do, when you're going to do everything. And you just kind of follow through that cycle. And I find on my side of things, in my everyday line of work, the struggle I have with that is then when doctors come to me saying, I want to do something different, it's so long since they've thought about what it is that they want, because they just kind of went down this pathway, that the first question I always ask them is well, what do you want? What are you picturing for yourself? And they don't know how to answer that question, which they just know, I don't want what I have. They don't know what I'm building towards. And I think that intentionality, what you can do to design a life in medicine that works for you, right? Whether it is clinically or whether it is, in other realms. And that whole world is your oyster, and you've got so many skill sets as a physician. But the first thing you have to ask yourself is what does that ideal life look like for me, so I know what I'm building towards, and not just, oh, what's the first side gig that I find that I'm qualified to do? Because you get to do something else and not like that either. So we always tell everybody, make sure it's not that you're just running away from something, but that you're actually running towards something. And if more physicians sort of went through that thought exercise earlier in their training, they may have found pathways that fit better for them, or jobs. It might be that their specialty is just fine. The particular job that they picked. One of the things we do on physician side gigs is we do this transition to practice series where we all talk to the residents and fellows a lot about intentionality, and throughout that last year of training when they're thinking about what job that they're going to take. And, so many of them are like, well, my mentor recommended this job for me, so I'm just going to take that job. There's this opening at my institution, and that just seems really easy, without thinking is this going to give me the lifestyle that I want? Is this, and so that's part of the reason why you see that within the first 5 years, doctors change their jobs. They pick the wrong job to begin with. And sometimes I think, especially in today's healthcare environment, that can get really confounded with this same iteration of, I shouldn't be a doctor, which it's well, maybe you just don't have the right fit, right?
It's not here, maybe.
It's not here, maybe. And for me, that's from a policy standpoint, I think I teased upon earlier that I'm a big policy nerd. And so when I look at that, I'm we have all these healthcare shortages. The goal is not to get everybody to leave medicine. The goal is to find careers within medicine that work for the life that people want, so that it is sustainable for the next 10, 20, 30 years, right? So how do you do that? And I think that that's the pathway that we're trying to get the residents and fellows to think about. Be honest with yourself. And the other thing is we're also canned in terms of our, we know what answers we need to give for interviews. At some point we start ingraining that into ourselves. It's okay, part of being a successful doctor is wanting to publish 18 papers a year and do this and do that. And at some point you need to be getting out of interview mode and saying actually, what do I want for myself and what do I want for my life? And then picking jobs based on that. And so I do wish that that was emphasized throughout earlier training processes.
In the last role, I hired a lot of young physicians coming out of residency. And it's so exciting to see that they're so passionate. And they are, I would say, way ahead of wanting to make the change in the system than I was when I first finished training.
Right.
So that's exciting to see. At the same
Yes.
time, I have to tell them that it's work in the first 5 years of your post residency.
Yeah.
You can serve the community a lot better if you pace yourself and do it over 30, 40 years, which is what physicians did in the past, right? So, and also, the financial education piece is another big gap that you get yourself into this amazing job with a lot of money, but the work culture or the work they're expecting you to do leaves you dissatisfied as a physician.
Yeah.
And doesn't let you do the kind of conscientious work you really got into the field for.
Right.
And that level of that dissatisfaction cannot be solved by money.
No. I think that's, it's funny because we talk a lot about financial independence in the communities, right? And a lot of the impetus that people have behind alternative income streams is to be able to establish, to expedite that pathway towards financial independence where they're not depending on their job for their everyday expenses. And I always tell people, I'm like, my husband and I were fortunate to hit financial independence very early in our careers. I was still in my 30s, despite a relatively late start with, two residencies. My residency and fellowship were 5 years. His was 9 years old. And so we ended pretty late, but we hit financial independence pretty early because I think we did, diversify our income streams. We were very financially responsible. We'd go out and spend everything, in our first paycheck immediately. I really has allowed us to not need the money. And honestly, for us, people are like, well, why don't you just quit and go? And we're like, actually, it's amazing because not having to worry about the money has made us love our jobs so much more because we're there because we want to be there. We can say no to the things that are causing burnout. So, if we want to drop a certain type of call or we want to say hey, we're not doing those extra hours. We can do that without worrying, which has really extended our career longevity so much. We're living our best lives doing what we want to be doing instead of having to worry about, okay, I know it's really making me tired and I need some time to recover. They're offering this extra shift where I could make another $1,300 if I stay 5 hours later. Every week is an act of survival. When people ask us, when are you guys going to retire? We're like, well, if we could practice the way that we're practicing right now, I'd love to see myself practicing at 70. I'm doing it on my terms. And it's really fun. So I'm a big believer in sort of establishing that strong financial background very early and having that foundation where that money's growing. You're going to be set for retirement when you need to. And that way, everything you're doing is I want to be here rather than I have to be here.
Yeah. Okay. I know you're short of time. So last question. What was the final impetus to actually get the physician side group started and the entrepreneurial journey you were on?
So I wish I could say I was a genius. I'm not.
You are, but okay.
No.
Yeah.
It was not intentional. So basically, when my husband finished his fellowship, we both had jobs lined up in the Northeast. And at the very last minute, he got just this incredible offer in Charlotte that we could not turn down. But what that meant was I had 6 months before I was able to find my next job and be able to get credentialed and get all set up to be able to do that. And so I had downtime for the first time in my life. My two kids were relatively young. One was in kindergarten and one was, only a year old and still napping a lot. And so for the first time, I was like, I have all this time. And I started writing just to get some things off my chest and talking a little bit about burnout, talking about some policy issues. Some of those pieces got picked up by Forbes, NewsHour, some big outlets. People started asking me to speak. And I was like, I don't know anything about I'd been an academic physician with grant funding. While my husband was doing his fellowship, I was on faculty at Chapel Hill doing all those types of things, but I'd never done anything outside of kind of what I'd been trained to do. So I started this community just to be able to connect with other doctors. And I think it was just right place, right time. People started adding their friends. And at some point when it hit, I think 15 to 20,000 people, my husband was like, you need to shut this thing down. It's taking on a life of its own. You already have a full-time job. What are you doing? And I was like, I kind of think I'm on to something. And I don't want to take it away from people. And so then we had to kind of think about, well, how do we make this sustainable? And so we started adding elements, hiring people to do the things that I didn't have the time to do. And so then, since that, the fortunate thing for me is that I just kind of get to stick by my North Star and ask what would I have wanted when I was at different stages in my career? And if something fits that, I have the privilege also of having my dad be a practicing, cardiologist. And so sometimes Greg and my husband, my dad and I will just sit down and be like, what are the things that we wish we had? How do we bring those to the communities? And that's kind of our guiding light and what the communities tell us and we make things happen. So health really came out of I was attending these things and I was like, why aren't there more doctors here? And like, what is our role in this ecosystem? And how do we take like charge of that role? And how do we take ownership of it? And so then, we teased it a little to the communities and it was clear that there was interest. Now we're here. So,
That's amazing. I think even it goes to show that we always underestimate the value we're bringing to the table, and our opinions and our thoughts have value, and just to get it out there, which is what I'm trying to do. So thank you so much,
Amazing.
Nisha. Thanks for
Yes,
joining
thank
us.
you so much for having me. And I'm
you.
really looking forward to seeing what you build.
Absolutely.
All
Thanks so
right.
much. Take care.
Bye.
Bye.